Welcome to True Health Tuesday, and the truth will set you free. So today is part 2 on cancer. Okay, last time we talked about cancer being a metabolic disorder, not some weird disease attacking you, but it means that you're actually creating it yourself. Okay, now there's certain predisposing factors such as environment and what you're eating, which medical care, all the other stuff. That's why we talked about how statins are linked to prostate cancer, how a lot of medical procedures weaken your body's immune system. So this one, we're going to go over some breast cancer screening. We're not going to go over solutions, a lot of solutions, okay? But we just want to inform that it's a metabolic disorder, but let's look at mammograms, thermographies, and how to look at prostate and what prostate cancer actually is. Now, we are going to have a censored portion. The censored portion tonight is on censored therapies, because there's a lot of therapies that you can't talk about in this country. Like I had one doctor friend who's probably the most brilliant guy I ever knew. He graduated high school at 7 years old, got his first bachelor's at 9 years old, okay, went to medical school, studied genetics for 10 years. I mean, this guy is brilliant. He just recently retired, but he was curing cancer at his clinic. And I can't even tell you, it was located in one of the Midwestern states, okay, and he's retired, but he didn't call it cancer therapy. So we're going to talk about some cancer therapies that you can't talk about. I know, welcome censorship. And so the Dr. B VIP will watch this uninterrupted. Extreme Health Academy, if you get a chance to get on there, it's amazing. 2 weeks for free. Bergman 14 is the code, but you're going to see a heck of a community there for healing. Now, this came out today, okay, May 9th, and we have the U.S. Preventative Services Task Force. Now, they're planning to lower the screening age to women to age 40, from 50 down to 40, and they're going to do the screenings every other year. And according to the USP Task Force, and you'll see up here where grade B recommendation is 40 to 74, it's a grade C recommendation, dropping it down to women in the 40s, according to theirs. Now, B recommendation or C recommendation, you might wonder what that is. But what they say is it's new and inclusive science about breast cancer in people younger than 50 has enabled us to expand our prior recommendation and encourage all women to get screened in their 40s. We've known a long time that breast cancer saves lives, and the science now supports that all women get screened every other year starting at 40. So now I went to the U.S. Preventative Services Task Force, their site, and looked at the recommendations. Okay, so let's look at this. This is off of their site. So, you know, if you want to censor me, censor the site, okay? The decision to start screening mammography women prior to age 50 should be an individual one. Women who place a higher value on potential benefits and the harms may choose the every other year screening between ages 40 and 49. However, while screening at mammography in women ages 40 may reduce the risk of breast cancer death, the number of deaths averted is smaller than that in older women, and the number of false positives resulting in unnecessary biopsies is larger. The balance of benefits and harms is likely to improve when they move from early to late 40s. In addition, the false positives results in unnecessary biopsies. All women undergoing regular screening are at risk for the diagnosis and treatment of non-invasive and invasive breast cancers that would otherwise not have become a threat to their health or even apparent during their lifetime, otherwise known as overdiagnosis. So I'm going to go back to the first one. This is off of MedPage, and MedPage has some good information. It's also propaganda. This is the actual thing saying, do you get a different feel from one article to the next? Like one is saying, okay, this is now, we're going to save lives, and the other one is saying, you know, it should be an individual one. We don't know if it's causing more harm. So let's look at this, okay? According to the American Cancer Society, regular mammograms as long as the woman's in good health, okay? But mammograms aren't perfect. They do have risks. Sometimes mammograms find suspicious tumors that turn out to be harmful. And they also carry risk of pain, anxiety, and other side effects. Some screening tests have risks, false positive, false negatives. Finding a cancer may not improve the person's health or help the person live longer, according to the National Cancer Institute. False positives. Mammograms don't prevent death. Mammograms can cause breast cancer. According to the National Cancer Institute, being exposed to radiation is a risk factor for breast cancer. The risk of breast cancer from radiation exposure is higher in women who've received radiation. Studies on mammograms. The mammogram uses 200 times more radiation than a chest x-ray, okay? Journal of Radiology Protection. Controversy exists regarding the biological effects of low energy radiation used in mammography breast cancer screenings. The low energy rays may be 4 times more effective in causing mutational damage than higher energy x-rays. Let's look at the British Medical Journal. This analysis supports the claim that the introduction of breast cancer screening may have caused net harm for up to 10 years after the start of screening. Okay, do you think it should be like an individual choice right now? Okay, why are they recommending it? Now, this is a metabolic disorder. It's not something that you're going to catch. You have to earn this. Okay? In a large European study, carriers of the BRCA gene mutations exposed to diagnostic radiation before 30 was associated with an increased risk of breast cancer. British Medical Journal. Study lasted 25 years, involved 90,000 women, found that the death rates from breast cancer were the same in women who got mammograms as those that didn't. The same. Okay, in conclusion, our data shows that annual mammography does not result in a reduction of breast cancer-specific mortality. British Medical Journal. Mammograms can actually cause more deaths than they prevent. Lancet 2000, screening for breast cancer with mammography is unjustified. Swedish trial 2000, there's no reliable evidence that screening decreases breast cancer mortality. 2006, for every 2,000 women who receive mammograms, the number of extra procedures increased by 10%, the number of mastectomies increased by 20%. Gee, is there something else you can do that would be less harmful? Yeah, how about thermographies? Okay, thermography is measuring energy coming out. We'll get into this a little bit. It's just I want you to like think, well, what do I do? You know, I mean, how do I check these? Okay, so I know the guys are going, I'll give you a hand, babe. Okay, yeah, no. Okay, now think of this. Okay, so we know that the process is not accurate. It doesn't seem to save lives unless you're trying to advertise for it. So there is a propaganda thing there. 2,000, now this is the Cochrane database. 2,000 women must be screened for 10 years. Okay, 200 women, and this is in order to save one life. Okay, using this therapy to save one life, 2,000 women have to be screened for 10 years. 200 women will get false positives, 10 will receive surgery and chemotherapy, even though they don't actually have cancer. And now these are secondary and tertiary cancers that can be caused because of the screening event. And the Cochrane database, thus it's not clear whether screening does more harm than good. British Medical Journal. Despite the growing number of harms, cancer screening advocates still claim it saves lives. The assertion rests, however, on reductions in disease-specific mortality rather than overall mortality. A systematic review of meta-analysis of cancer screening trials found that only 3 of 10, 33%, showed a reduction in disease-specific mortality, that none showed reductions in overall mortality. So where are they pulling that recommendation? Oh, it's right here, you know? I mean, it's nuts, okay? Journal of the American Medical Association. What has emerged is an appreciation for the complexity of the pathologic condition called cancer. The word cancer involves a specter of inexorable lethal process. However, cancers are heterogeneous and can follow multiple pathways, not of all which progress to metastasis and death. This is what we covered in part 1. We were talking about a lot of these cancers were misdiagnosed, particularly ductal carcinoma in situ. And this is actually was considered a cancer. Then they changed it to not being a cancer. Okay, and then we're looking at 80% of those things, 80 to 90%, are remitting and relapsing. They go away. So a lot of these things, remember, it's a metabolic disorder. So this means that you have to have some type of exposure, and your body forms the tumors. The tumors aren't formed by demons. Okay, so the body is forming this stuff to wall off toxins. Okay, now, ductal carcinoma in situ. It's non-invasive, stays in the milk duct. Lobar is an overgrowth of cells that stay inside of the lobar. The most invasive ductal carcinoma, the most common type, and surrounds the normal breast tissue. Ductal carcinoma in situ. Okay, and this is the non-invasive breast cancer. 33% have mastectomy. Okay, 48% lumpectomy and radiation. What do we know about radiation? It can cause more cancers. A lumpectomy, 3% do nothing. Now, what does chemotherapy do? We're not going to get 100% into the different types of chemotherapy, but what does it add when you're talking a 5-year survival? How many years? 2.3% in Australia and 2.1% in America. That's what it adds. Okay, now read that backwards. 97.7%, it does nothing in the Australia. 97.9% in the USA, it does nothing. So, and but it is expensive. John Cairns from Harvard, whether any of these common cancers can be cured by chemotherapy has yet to be established. Now, the mastectomy. Now, this is actually a medical procedure where they're removing a breast. Now, as psychotic as our world is, they're actually doing this procedure to teenagers who are not happy with their breasts. That's called mutilation. But now here, if you're removing this isn't a benign procedure. Okay, you're talking nerve damage, lymphedema, removing the lymph nodes can swell this up. We see that a lot in patients. The government admits that chemotherapy and radiation can cause a cancer in themselves. Okay, now when we look here, winning the war on cancer or accumulating wealth. The Chronicles of Philanthropy, now this is older, it's 1992, but the American Cancer Society is more interested in accumulating wealth than saving lives. Now, does anybody who's over 20 remember when the war on cancer started? We're right on the verge of finding the cure. Come on in, we can find the cure. Okay, you know, it's always like that. We get patients now who say, yeah, you know, they got this new experimental drug. There's always a new experimental drug, okay? The frustrating thing is tamoxifen, okay? There's so many drugs out there that were told that they're going to be fantastic. Breast Cancer Awareness Month was initiated by companies that make tamoxifen. The devices for mammograms are made by General Electric, and General Electric in a relationship with people behind Breast Cancer Awareness Month. So there's a huge industry that's invested in breast cancer. Although the goal is noble, to me, it's an obscene that these companies are using the symbol of the pink ribbon for commercial purposes. Very few dollars ever make it to really help women. Do you remember the pink ribbon on Kentucky Fried Chicken boxes? Okay. Oh, I'll show it to you. Look it up. I mean, you got to find it in the Wayback Machine. I mean, our product may be toxic to you, but you know, we're supporting what we're causing. Okay, so let's look at thermography, and this is what I recommend, okay? Figure a mammography is going to find the cancer the size of a head of a pin, and that's been growing about 9 years. A thermography is not damaging the body. We're measuring energy coming off of the body. Okay, and so you can see an area of increased metabolic response because this is a metabolic disorder. Okay, it's a metabolic disorder. So if you see an area of increased metabolism, that would be a clue. I know what you want to say. Go slower. It's a metabolic disorder. So if you see an area of increased metabolism, that would be like a clue. Okay, and then it helps you to look at the cause. I mean, if you know that lymph drainage, 85% of breast cancers are on the left side. Why? One of the theories is that lymph drainage for the gut drains the upper left quadrant. So that means people are eating stuff bad. This is why there's an increase in cancers if you take antibiotics. If you have a leaky gut, there's going to be a lot of stuff. 15% are on the right side. Why? Well, because that's where dental and pulmonary drains. Okay, so that's a theory. But wouldn't it be nice to know, wow, you have an increased metabolic response here, we better look at dental toxicities. You get an increased metabolic response here, you better heal the gut. You know, I mean, it just makes sense. They say this can detect signs of breast cancer as much as 10 years earlier than a mammogram or a physical exam. Okay, now the prostate. So it's just a slam on mammography because I'm not a big fan of mammograms. Okay, you know, because it does damage and it's not. And I just thought it would be important to be aware of that. Now we're going to look at the prostate. The prostate is the size of a walnut. Okay, this is not big. And it's located right in front of the anus, okay? So this way, if you have good stool formation, okay, that means you're eating healthy amounts of fiber. Every time that poop goes by, okay, it's massaging the prostate. So it secretes a fluid to help the sperm survive in the vaginal area. Now, this is benign prostatic hypertrophy, okay, BPH, or hyperplasia. This is where it's swelling up. Now, why would this swell up? Well, if you're eating commercially produced dairy, this is loaded with synthetic female hormones. That will cause it to swell. If you have a sedentary lifestyle where you're sitting, you know, trucker, office workers, you know, that's going to expand that pelvis and be a problem. If you're exposed to endocrine disruptors, like in glues, plastics, that new car smell. I was up at a seminar in Montana, and I'm driving in this brand new Ford, and it was a great car, okay? But I'm smelling that new car smell for 2.5 hours. And I got the window rolled down and it's 40 degrees outside. But I didn't want to get the endocrine disruptors from that new car smell, okay? Great seminar though. But 50% over 50, 60% of men over 60, 80% of everybody over 80 have the swelling of the prostate. Okay, so now in my brain, I'm thinking, what are the 20% of people over 80 doing? So I'm going to tell you what to do to have a healthy prostate. Now, this is the bladder. The prostate's right underneath it. And if it swells up, it shuts down the urethra, so you can't really urinate well. And this is interesting because when you look at this, the normal to abnormal, it's just swelling of it. Okay, that's it. Now, you know, symptoms for prostate problems. Going to be frequent urination, you're not able to evacuate the bladder, and dribbling, weak, pain in the bottom, low back pain, scrotum pain, rectum pain, testicles, painful orgasm. So these are symptoms that the prostate isn't working right. Now, I had a patient and he recently died at 99 years old, but when he was 80, he gave me this prostate formula, okay, that we still use here, and his advertisement for it was, I can put out forest fires. Yeah, I know it might be TMI, okay, I'm just telling you, okay, this is how guys talk, okay, the girls should just go like this, but you know, you gotta love normal guys. We gentlemen, do we talk that way? Yes, we do. You're not going to admit it because your girl's right next to you. Okay. Now, a prostate-specific antigen, the PSA test, this is super, super common. The problem is the theory doesn't hold well. Now, PSA stands for prostate-specific antigen, a protein produced by the prostate. The theory is that if PSA goes up, cancer cells go up. So a higher level may indicate prostate cancer. Now, the Journal of the National Cancer Institute, they found that PSA, prostate-specific antigen, was found in females with breast, lung, and uterine cancers. The highest levels of PSA had been found in females recovering from breast cancers. So I know what you're thinking. Okay, now this is tough because there's two sexes. Women don't have a prostate. Okay, they really don't. Okay, no matter what you want to talk about, okay, they don't have a prostate. So that the sample is not specific to the prostate, PSA, even though it's called prostate specific. Biopsy is horrific. Remember, this is the size of a walnut. It swells up a little bit more. So now to get a sample, you have to do 6 to 12 large gauge needles in here, and you draw it in there, pull it out, squirt it in there to, on a sample tray to see if you're finding abnormal cells. Now, does anyone in here stabbing a thing the size of a walnut with 6 to 12 samples or a needle might damage the organ we're trying to protect? Yes? Yeah. Okay, I think so too. Here's one. Okay, you can see that the rectum, I always like this joke. Rectum? No, it damn near killed him. Sorry. How often can you say a joke like that? Okay, it's okay, but you can see the rectum's right behind, okay, where the prostate is. This is why when we recommend prostate massage, which is one of the greatest things in the world, it's fantastic. Here's another way. You can go up the penis and get it. Oh, God. Okay, transperineal, okay. You go right through. It's between the testicle and the anus. I mean, okay, now, the annual cost of prostate screening, $3 billion. The person that discovered the PSA test, okay, because remember, PSA testing for prostate is controversial because it costs and it's uncertain long-term benefits. PSA tests have been consistently shown to have false positives, false negatives, and overtreatment of low-risk cancers. I never dreamed that my discovery 4 decades ago would lead to such a profit-driven public health disaster. The test is hardly more effective than a coin toss. Dr. Richard Alblin discovered PSA. American Urology Center, this is 2002. Dr. Stamey, okay, published the original study in PSA in New England Journal of Medicine, 1987. Our study raises very serious questions of whether a man should even use the PSA test for prostate cancer screening anymore. Dr. Stamey, I removed a couple hundred prostates I wished I hadn't. Yeah. Here's a patient. Okay, now this guy, he's actually, this is a couple of years older. I think he's 80 now, but if you saw him, you would say, damn, 80 is the new 40. So this guy is built, strong, powerful, amazing. When he was at 65, they said, yeah, your PSA test is going up, and so you should remove it. Now, when you remove a prostate, okay, you can have bowel issues, sexual dysfunction, bladder issues, control issues. You can have a lot of problems because you can see right where it is, okay? His PSA test was going up. And he went to his oncologist and he said, Doc, you told me 10 years ago that if I had this sucker removed, I wouldn't have any problem at all. I wouldn't have any risk. What did the oncologist say? Well, we know a lot more now than we did then, Bob. Okay. I'm sorry, you guys went through 3 years of psychosis. And in our society, I can't even talk about specifics about the 3 years of psychosis. I can't even mention certain things because of the environment we're in. So can you imagine that this has changed a little? Yeah, okay. Prostate screenings. Prostate-specific antigen screenings result in small or no reduction in prostate cancer-specific mortality. Which is associated with harms related to subsequent evaluation and treatments. American Society of Clinical Oncology, it's uncertain whether the benefits associated with PSA testing for prostate cancer are worth the harms associated with screening and unnecessary treatments. Gentlemen, just keep thinking. Large gauge needle shoved up there 6 to 12 times. American Cancer Society does not support routine testing of the prostate at this time. We still cannot say whether the benefits outweigh the risks. Chief Medical Officer of the American Cancer Society, Dr. Otis Brawley. New England Medical Journal, screening did not reduce death rate in men over 55. Most men with an elevated PSA turns out to not have prostate cancer. Only 25% who have a prostate biopsy due to an elevated PSA level actually have prostate cancer. Read that backwards. 75% of the people don't have it. Okay, so it's a metabolic disorder. This means that people are eating it, or they're consuming it, they're exposed to it. This is the body producing this. European randomized screening of prostate for prostate, 182,000 men, 50 to 74. After 9 years, they concluded that 1,410 men would need to be screened, and an additional 48 cases of prostate cancer would need to be treated to prevent one death from prostate cancer. 182,000 men. Okay. American Journal of Medicine, 20 years of screening for breast and prostate cancer, several observations can be made. The screening may be increasing the burden of low-risk cancers without significantly reducing the burden of more aggressive growing cancers. And again, this is a metabolic disorder. Okay, when I tell people, you know, you're going to go get this test, assume it's positive, assume you have it. What are you going to do? You're going to change your lifestyle immediately. Okay, you're going to start to look at your physical, chemical, emotional stress. You're going to start to detox using hyperbaric chamber, juicing, blending, the thousands of different things that we're going to cover next time, and we're actually going to cover in the part that's censored after this. So I'm going to show you some therapies that I can't even mention. Testosterone. Okay, and by the way, testosterone is responsible for a lot of things. Okay, males and females. How many sexes are there? Two. Okay, good. I'm just if you're watching TV, you might be confused. Males metabolize testosterone completely different than females. Okay, so you cannot turn a girl into a guy by giving them testosterone. It doesn't work that way. Okay, it never has, never will, never will. Okay, you know, because you metabolize it different. But look at this. Testosterone is responsible for regulation of the prostate, but remember the hypothalamus? Okay, you've got the pituitary, which is the master gland. That controls a lot of hormone regulation. That pituitary is controlled by the hypothalamus. The hypothalamus gets its information from the entire central nervous system. So if someone has physical, chemical, emotional stress, or they're exposed to endocrine disruptors, things that are like hormones but not really hormones, okay, they're going to have a problem. Now, what does testosterone also do? Development of reproductive tissue, sperm development, cognitive, brain function, physical energy, tissue healing, bone health, strength, cardiovascular health. What does low testosterone do? Now remember, males are exposed to so many plastic and estrogen related endocrine disruptors. Okay, and this is going to be in glues, plastic, pesticides, shampoos. What is low testosterone? Diabetes, obesity, cardiovascular, Alzheimer's, dementia, strokes, heart attacks, sleep disorders, reduced sex drive, infertility. Normal or above average testosterone, increased mental and physical energy, increased vitality, improved, decreased heart attack risk. So testosterone for males, not for females. Females produce testosterone in a smaller amount because they metabolize it differently. So you can't give testosterone to a girl and expect her to be a guy, and you can't give estrogen to a guy and expect him to be a girl. You know, maybe the males can turn into a politician or something, but, you know, they can't really turn into a girl. Have you seen our politicians? Okay, just checking. No testicles. Okay, so when we look at this, testosterone replacement is dangerous. You do not give your body something that it makes. And when they say bioidentical hormones, guess what? That's a friggin' lie. It's not 100% bioavailable, and it's not identical. Your hormones are produced exactly with what you need at exactly the right time, at exactly the right dose, and you're not allergic to them. Okay, this stuff is not true. Now, the testosterone, okay, here, I'm going to go back one more time. Okay, normal testosterone, this means your body is producing it, okay, helps with all of these functions. Decreased heart attack, lean body mass increases, diabetes decreases. When you get a synthetic supplement, okay, or medication for it, the FDA requires that testosterone pharmaceutical labels include a warning about the possibility of increased risk of heart attacks and strokes. This is what happens when you give this to people. Excessive testosterone, 30% increased risk of stroke. Now, what's the real cause? The real cause, because remember, cancer is a metabolic disorder. Have I said that yet? Okay, I want to drive this friggin' point home, because if you're scared because, oh God, my great uncle on my mother's side had it, okay, and this, yeah, put that fear in the friggin' trash can. Okay, let's look what causes it. Central nervous system disorder. So that means you've got compromised nerve supply to the area, or you're in a chronic state of stress. Prescription drugs, we already know that statins are linked to it, but also antacids. We're looking at a number of different medications. So if you're taking a medication, understand that those slow or stop metabolic processes. Injury to the prostate, that means truckers, drivers, bike riders. We're talking big time. I mean, you look at all the bike riders around, okay, they're gonna have some type of pressure on that prostate. I've been riding bikes for years, but I've ridden nothing but recumbents. I mean, it's comfortable. You pull up to a stop sign in that, man, you're just still hanging out. It's comfortable. You pull up to a stop sign with a wedgie thing up, you know, you're getting off of that. Give me an amen, brother. Okay, injury to the prostate, pelvic trauma, dehydration, and stress. Now, here's the natural solutions. Restore the nerve supply. If you have a pelvic trauma, this means if you have a bunion formation, that means the nerves that supply that foot are compromised, and that means that the pelvis could be unstable. That's a big clue. Regular exercise. What does exercise do? It helps natural testosterone production. It helps natural growth hormone production. Strengthen the immune system, hydrate properly, healthy sex life. Okay, I'm talking, you know, you're talking weekly orgasms or at least a couple times a week. Prostate massage. And this is hugely important because when I went to Catholic school, anyone else go to Catholic school? Nether region, right? Okay. I taught human dissection anatomy. There is no nether. I tried to find it, okay? I know, you know, you just don't talk about that, okay? Yeah, now the pendulum swung the other way where they're doing all sorts of education that is completely bizarre. Okay, so, but prostate massage is fantastic. You know, talk to your spouse. I mean, it's super important, just putting moist heat on there. But what does that do? That rushes blood to the area. Natural anti-inflammatories. This is going to be fruits and vegetables. Anything, because you've got the poop chute right behind it, okay, the rectum. So if you got healthy stool formation, this means eating fiber with every meal. You're going to get a prostate every time you poop. And you should be pooping 2 to 3 times a day. Moist heat, warm bath, limit or avoid alcohol or caffeine, prolonged sitting, because caffeine loosens stools. And deep sleep. Kegel exercises, okay? If you haven't done Kegel exercises, when you're writing your name in the snow, okay, wait. How did you teach your sons how to urinate? Okay, how to get out of the diapers? You know what you did? Okay, hold it, buddy. We got the bush in the back. Okay, we're going to go water it together. Okay, and if it's snowing outside, you could write your name. Okay, this is a skill that men can do. Okay, but when you're stopping it to do another letter, okay, when you're stopping that urine flow, that's the Kegel exercise. Girls do the same thing. I don't think you're good at writing, but you know, it's that stopping it, okay? That muscle that you tighten up, that's a Kegel exercise. Okay, now if you have an unstable pelvis, and what's the clue of that? Is you're gonna look at the bunion formation. But the Kegel exercises, and you hold it, and you know, if you're home, you know, or sitting down here, okay, we're gonna tighten up that muscle on 3. Ready? 1, 2, 3, hold it. 1, 2, 3, 4, 5, relax. Then 1, 2, 3, 4, 5, relax, okay? And do that 4 or 5 times. And you could do it just when you're thinking about it. Why? Better urine control, okay? I mean, I saw an advertisement for adult diapers, and I'm thinking, wow, what a society. Why don't we restore nerve supply and give healthy bladder control instead, you know, it's like an old British engine. A buddy of mine said they couldn't fix this one, I forget what kind of motor it was, but he couldn't fix the leak in it, so he just put a diaper on it, okay? And, you know, they put a pad in there to absorb the oil. It's a good motorcycle, but it leaks. British Medical Journal, men with prostate cancer are 7 times less likely to die if they have high levels of vitamin D. American Journal of Clinical Nutrition, vitamin K may reduce your risk of prostate cancer. Journal of Human Nutritional and Dietetics, results suggest that general dietary modification has a beneficial effect on prostate cancer. And if anyone hears that beautiful angelic noise, it's a cell phone. So what do you do for a healthy prostate? Okay, this is the diet. And again, you could wait till you feel bad, till you have poor urine, but you're gonna have it, okay? It's, 80% everybody over 80. Eliminate processed sugar. Processed sugar is not good for you. Reduce environmental toxins and heavy metals. Detox your body. Eliminate all processed or non-packaged foods. Animal-based omega-3s. Selenium, that's Brazil nuts. Okay, selenium. If you want a really good dessert, you take a date, put a Brazil nut in there or selenium, and eat it. Freaking amazing, amazing. Okay, at least 4 to 5 a day. Vitamin E, and that's the natural version, not the synthetic one. Vegetables, juice, broccoli, sprouts, to help control the extra estrogens. Walnuts can reduce prostate cancer growth by 30 to 40%. I mean, isn't it? It's like this is the solution. You massage it, you stabilize the pelvis, you reduce the stress, you reduce the toxins, and then you could have a healthy prostate. It seems so simple, but it is. So when we talk about this, we talk about the physical, chemical, emotional stress. The 5 keys to health, okay? Healthy nerve supply. Why? Because if that nerve is compromised, you're not going to have healthy tissue. Regular exercise. What does regular exercise do? It stimulates growth hormone, stimulates testosterone production, helps your body balance hormones, help you build, lean muscle. I mean, it's fantastic. Proper nutrition, and this is no magic on this. Okay, eat what your great-great-grandparents ate. Okay, remember them? They ate nothing but organic, they ate nothing but seasonal, they ate nothing with very few preservatives, okay, and they lived to 90 or 100 years old. Okay, sufficient rest. This is when the body regenerates. And if you say, well, I have a prostate problem, I get up every 2 hours, look at our sleep restriction videos, because there's going to be a way to reset those circadian rhythms. You're not getting up because your urine is increased production at night. You go through 90-minute cycles called rapid eye movement. When you complete that rapid eye movement cycle, your eyes literally open, then they close. And if there's any light source, bam, the fight or flight system kicks up, and you got to get up to evacuate your bladder to because you're in sympathetic stimulus. So eye coverings, night shades. Look at our sufficient rest videos. And then prayer and meditation. What does prayer do? And I'm talking, only do it on days you brush your teeth. So daily. Okay, what do they say? I mean, prayer and motivation are done like bathing, best on a daily basis. Okay, yeah, it seems too simple. Now, we are going to get into areas now because, we have certain medical procedures that we can't talk about. They actually passed a law called SB 2098 in California that if you're a medical doctor and you say anything against a certain medical procedure, even though it's true, okay, it doesn't matter because the government is now controlling our speech. And the government has actually been accused and, well, when somebody actually does something and somebody tells the person that they did something and there's proof of it, can you say they actually did it, or do you have to keep saying it's accused? They actually did it, right? Okay, yeah. Yeah, so the government is actually limiting free speech by paying companies to censor speech. And free speech, I think, is the First Amendment. Okay, so now we're getting to a world where we're going to be talking about stuff that we can't talk about on this one. So if you're watching on Dr. BVIP, and by the way, we have about 3 more months before this massive site's going to be open. We have our own server. I'm going to be able to talk freely without any interruption of censorship. So, and we're going to be blending the Dr. BVIP. Hopefully, we'll be blending the Extreme Health Academy and everything into one site. So this way, I don't need to worry about shit. So I'll see you later, YouTube and Facebook. God bless you guys, but we're gonna get you in a platform that